Dr. Cho, nice meeting you. Can you tell us just a little bit about yourself, your position at Hong Kong U?
Actually, I'm an assistant professor and faculty of dentistry at HKU. Before I came here, I studied my PhD in the University of New South Wales in Australia, Sydney. Actually, my academic background is mechanical engineering.
Very
From
good.
bachelor degree, master degree, PhD, everything was I studied mechanical engineering. But during my PhD, because I have studied dental materials, I got a position in the University of Hong Kong in the faculty of dentistry.
So, can you very briefly tell us about your project before I ask you some questions to elaborate on your research?
Yeah, okay. So in this research topic, actually we want to develop new type of dental clear aligner by using 3D printing technology. And also we develop micro nano optical sensors by using nano diamond composite. So we have technology fabricating nano diamond, very clean nano diamond, and also synthesizing nano diamond composite. By using that nano diamond composite, we can print very accurate nano dot array or micro dot array. We're going to use that array as an optical force sensor. So we are going to embed that very small size sensor inside the clear aligner during 3D printings. By using traditional microscope, we can measure very accurately the orthodontic force and also direction of the force. Currently, there's no any technology or measurement method measuring the orthodontic force on the clear aligner.
You know, I am very active in 3D clear printed aligners and shock memory aligners. One of the questions I have is at what stage you will embed these optical sensors?
First one, we have developed new resin system for clear aligner. So we co-work with some company in US. So that was most of mechanical, physical, biological property already investigated. And also regarding the sensors, we already fabricated prototype by using our 3D printer. We almost finished more than 60 or 70% of that printing or fabricating nano diamond sensor. Another challenging is how we can embed that nano diamond film sensor inside the clear aligner during the 3D printing process. That is another challenging issue in my projects. During this, if I can work with the IOF, maybe next year I want to do more research on this process.
So are you planning to embed after the aligners are printed?
Actually, first one is during printing clear aligner, I want to embed at the wall of the clear aligner during printing. Or another application, we can attach that sensor onto the film type aligner also. That is another approach I want to do. But in this project, I want to embed inside the 3D printed clear aligner.
I think it's very interesting because it's very difficult to measure in vivo force with aligners. And so it sounds very exciting. But the question is that when you use aligners, the force is kind of distributed all over the teeth. And let's say if you want to look at the force on 2 or 3 different teeth or segments, that means you will have to embed these in different places.
Yeah, you're right. I want to embed one sensor in front of each tooth, wherever you want. But we don't need to embed every tooth area, teeth area, but some specific area we can embed to monitor the orthodontic force.
And what sort of information you would get? I mean, would you get moment to force ratios, moments, or just forces?
Force. So we can measure the amount of force. And also we can measure the distribution of the force direction as a mapping image. That is a basic study because we know the mechanical property of the film and aligner. So by measuring just the displacement everywhere. So we are going to use the DIC technology, the digital image correlation process. So we can have a mapping image of the force, amount of force and also direction of the force.
Very good. Let me get back a little bit. So what sort of motivated you to go in on this field? Because it's quite a departure from your mechanical engineering area.
Yeah. Actually, one of my colleagues at HK, University of Hong Kong, they developed a very new technology fabricating very clean nanodiamond, they have already started develop some nanosensor by detecting the movement of a single nanodiamond. It looks like a physics, but I want to translate that technology to clinics. I have enlarged the scale of their technologies so we can make very accurate dot array in the several hundred micrometer scale. By using that technology, we can translate that nanoscale technology into the macro size scale and also translate it to the medicine, especially in dental research area.
Would you be able to modify the force delivered by direct printed aligners once you know how much force a movement is creating, a linear movement or angular movement? Would you be able to change that on the clear aligners?
I want to measure how much force and what's the direction of the force applied on the clear aligner. I want to monitor the change of the orthodontic force over the time.
So if a aligner is going to be used in the mouth for 1 week, you want to find out how the force is going to decay.
Right.
So let's look at clinically, because I'm a clinician. The reason I'm asking is we do clinical research and then we do lab research. I understand in the lab research, you are going to measure all these forces, but these forces are going to be measured in vivo in the mouth. I'm looking at the clinical significance, that are you going to certain phases of treatment, it will be used throughout the treatment?
Yeah, if possible, maybe all of the aligner we can embed, because the cost is not that much expense compared to the traditional aligners. We can embed these sensors every 2 or every 3 aligner, or we can change it, the embedding sensor area position based on the doctor's opinions.
I know it is only for 1 year, but next year I expect you to come back for more money because this research sounds very interesting. I think the efficacy of your study is going to be, I agree, on the manufacturing side. Because at that time you can modulate the force. If you find force is too much, you can reduce it. When the orthodontist gets the finished aligner, it has already been taken care of. So what are the problems you face in the study? What are the challenges?
Challenging issue will be developing very constant quality of the sensor, and also we don't have a clinical trial. It'll be final stage of this project. So I'm trying to have many comment or idea from clinical side.
So first you are going to look in vitro, right? In the lab. So clinical applications are far away so far. Am I correct?
Right. During printing aligner, we can embed sensor in accurate position of the aligner. So if you think it's a very thick wall in front of the wall, we can embed in the middle of the aligner. So it's very protected by the resin.
Because I'm looking at aligner, the resin is pretty fluid. It's liquid. And when it is coming in, it's just dripping resin.
No. We have technology. We can embed inside during printing.
During the printing. Very good.
We already started embedding traditional wire inside the clear aligner during printing. This year, in 2024 IADR, one of my students presented, and she got the CTOL Student Excellent Award in orthodontics. So.
Oh, really?
Yeah. She got an award. New Orleans, US.
He presented embedding wire during the printing of the line?
That was our technology. So we embedded it. Orthodontic wire inside clear aligner.
Maybe you can send me the title of the abstract or the summary of the abstract.
Of course.
I would like to read that. That's very interesting.
That research almost completed, so we are going to submit manuscript next month.
Very nice. I'm really happy with your research, what you're doing. We had a very nice meeting in 23, IOF meeting in Hong Kong. There were a lot of speakers there. I wish I would have met you there at that time. Thank you very much. If there's any other question, I can always answer for you. I am very active in IOF because the goals of IOF are to basically advance the research and the clinical aspects of orthodontics all over the world. And someone like you is going to be the pioneer because your research is what I would call a cutting edge research, and I'm very proud of what you are doing.
Thank you very much. Thank you.